Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is August 12th, and this is our COVID video update, and I'm here with Dr. Greiner today. Do you want to say hello?
Yes, thanks, Janelle. Alan Greiner. I'm a local family physician who works part-time at the University of Kansas Health System and also serves as the Chief Health Officer at the Unified Government Wyandotte County Public Health Department.
All right, well, thanks for being here today. We're going to be talking today about the new mask mandate that went into effect last Friday for KCK and some other parts of Wyandotte County. So just to kind of give the general background, can you tell us the basics about the order that was passed?
Yeah, so the new mask mandate was passed by the County Commission last Thursday, went into effect on last Friday, and really requires individuals to wear masks at all time when they're in public places. We'll get into a few more details about exactly what that means, but it covers Kansas City, Kansas, and unincorporated areas. It does not apply to Edwardsville, Bonner Springs, I believe city of Lake Revere, as well as public and private schools. All those entities have their own governing bodies, and the commission thought that it would be appropriate to have those governing bodies make decisions about whether they wanted to have mask mandates in those settings. But for the city, it is now in place, and we believe it will be helpful in reducing the spread of COVID.
All right, so you kind of hinted at this before that we talk about it more. Can you talk more specifically about what's covered by the order?
Yeah, so individuals, whenever they're in an indoor space, essentially should wear a mask. So in public, in a business setting, in a school setting, where it gets approved, of course, because it is up to those schools. But we want people, even if there's not somebody around, if there's a chance that somebody could come around you, we want folks to be wearing masks. So essentially, we're back to the situation where unless you're in your home indoor environment or you're in a private office, say, with a closed door, and you won't be interacting with other individuals, we want you to be wearing a mask, just because we're seeing so much transmission now, and we think it can be protective both for you and individuals you would come into contact with.
Sure. So we know individuals need to have their mask when they're going, out in the community and public spaces, but what does this mean for businesses?
So businesses need to not only have their employees wearing masks at all times, they need to require that customers and individuals coming into their place of business are wearing masks. It applies to individuals over the age of 5 years. There are a few exemptions for individuals who, for some medical reason, might not be able to wear a mask, but essentially anyone over the age of 5 needs to wear a mask. And we want businesses to post signs and require this of their customers, as well as their employees. Now in restaurants or bars, if individuals are seated in those settings and actively eating or drinking, they can remove their mask for that activity. But otherwise, again, we're wanting those businesses to have employees and others in the place of business wearing a mask at all times if they're not actively eating and drinking.
All right, thank you for clarifying that. So we have this mask order now. We've seen some other mask orders in the metro area and other public health experts talking about the need for masks. Can you explain why we're asking people to wear their masks right now?
Yeah, so there's a variety of reasons. Number one, we feel like from a medical and public health perspective, there's a whole lot of evidence now that masks prevent spread of COVID-19. We've seen in healthcare environments, for example, in hospitals, when nursing staff wear masks and wear them properly, even if they're caring for patients who have COVID-19, we see almost no transmission of COVID-19 to that nursing staff. And that's been the case. We now have thousands and if not hundreds of thousands of data points to show that the masks are really effective that way. And so we've learned through the course of this pandemic that masks are very protective to you as an individual if you're wearing them properly, and they're also protecting those around you. If you happen to have COVID and you don't know it, you could still unwittingly spread it. So the masks prevent that as well. We've seen cases drop in the United States when we've seen masks put in place in different areas, and those areas who did it at different points in the pandemic tended to have less COVID than others. And the primary reason to push it now is because our case numbers are just going up really fast. We're now in Wyandotte County, we're now up to 89 cases a day on the 7-day moving average. We were down in the around 8 to 10 at one point this spring. And so it's gone way up. The percent positivity rate for all the case or all the testing that we're doing is up in the 30s again. I think it was 32% over the last couple of days positive. So almost 1 out of 3 tests that gets done at any place in the county is coming back positive. We're seeing lots and lots of cases in younger folks. So about 2/3 of the new cases we're seeing are in individuals 40 years of age and younger. And remember, those under 12-year-olds are still not eligible for vaccine. So they're a big group that's very vulnerable to getting infected. And although not very many of them get super sick, we are seeing rare cases of children getting very sick. So because of all that, we recommended it, and the commission followed through with the order to put the mask mandate back in place, just because of so much spread in vulnerable younger folks, and the evidence we have that those masks will make a difference.
All right, so you've talked about that spread that we're seeing, the increase in cases, and that we know masks can help us right now to help curb that spread. Is there anything else people should know about curbing the spread of COVID in our community?
Yeah, so we want to have multiple things in place to reduce spread, right? Masks aren't 100% perfect. They're very valuable. And we've seen lots of data and evidence for that. We know vaccinations are very valuable. So we want to keep getting as much of our population vaccinated as possible. Unfortunately, only 37% of the total population in Wyandotte County has currently been fully immunized. So we've got the vast majority of our folks who have not. So we want vaccination happening, and we want people to come get vaccinated. You can find out where to do that at wycovaccines.org, or just by calling the 311 government number and get the hours that you can come to the Kmart site at 78th and State. Or, of course, we've got pharmacies all over the county, hospitals and doctors' offices all over the county that now have vaccine as well. But we want people to also be careful about who you're around. We think social distancing is important again. So if you're going to be around individuals that you don't know their vaccine status, or you don't know if they might be sick, you should try to distance from them. Outdoor activity, of course, is much safer than indoor activity. That's something we've learned throughout the pandemic. So try to do things outdoors. And especially if you're going to be around multiple people, try to arrange things outdoors when you can. All those things are going to make a difference and get us through this current increase, because we're seeing numbers like we saw last January, and our hospitals are full again and unable to in some cases sometimes care for routine things and emergency things like heart attacks and strokes and broken bones. And if things get further along, we're very worried about the capacity there too.
Right. So with the hospitalizations, it's not just about reducing the COVID cases they're treating, but for anybody who needs to go to a hospital for whatever they might need for care, that this could affect those folks as well.
Right. So seeing, the rise in cases, which produces a rise in hospitalizations, most of which are in unvaccinated people. In fact, the vast majority of cases in the hospital are unvaccinated individuals who've gotten COVID from this current Delta variant. That increase, even if it's only 10 or 20% of the total bed space in a hospital, that puts a hospital in a pinch if they're pretty busy otherwise. And because we've had a lot of transfer requests from hospitals in, say, Southwest Missouri and Southeast Kansas, all of which are full right now, those transfers have come up here to Kansas City, filled the hospitals up, and we don't have the capacity to flex if we see patients who need to come in for some other emergency, again, like a heart condition or a bad infection or something that's not even COVID related.
All right, well, thank you so much for talking about this today. I just want to remind folks that they can go to whitegovaccines.org or call 311 to find out more about free COVID vaccines, as well as free testing opportunities, either going somewhere in person or having a test delivered to your home. And don't forget to have that mask with you when you're going to the grocery store, when you're going about your day-to-day activities. Thanks again. We'll see folks next time.
Thank you.